So at the last Senate, I went through some stuff, and I saw, and personally, both Nancy and I, and with Dr. Bob, and found out that we're really being taken out of the healthcare system. Whether we got Obamacare, whatever it might be, the situation exists where there's millions, I'd say, millions of Californians that aren't going to get medical care. They just can't get it. And these two people here that I'm going to introduce right now are going to tell you the good reasons why this is probably true and why we have to change the system, which I will probably tell you at the end because I found some great things today in my years of research on this. Anyhow, first I'd like to introduce a lovely, lovely young lady who has, for most of her life, about 25 years now, I guess, 45, right? Anyhow, that she's been involved in insurance billing and collections in both public and private sector hospitals, well, private sector hospitals, I won't say public sector. Anyhow, includes experience in all levels of single physician practices to hospitals with hundreds of beds. She's really well versed on who to contact, when to contact, and who not to contact, and when not to contact them. My wife, Nancy Torchia. And the next one is the noted physician, professor, author, and lecturer, has practiced medicine at UC Davis Medical Center, small towns, third world countries, head of the prestigious emergency room and operation at UC Davis, a lecturer, an author, and a professor, Dr. Bob Derlet. By the way, they have no idea what they're going to say. I really don't. They're going to be doing some very good winging here, I feel.
Start? Okay. Well, let's see. I started billing insurances before there were computers, and we typed them on the old typewriters. And I've seen the changes from fee-for-service, then the PPOs came in, then the HMOs, and now the changes to our Medi-Cal system, where a few years ago, I guess the state of California decided they really want to get out of the Medi-Cal business. So they contracted with Blue Cross and with California Health and Wellness to manage a portion of the Medi-Cal patients. There are still some that fall under what they call the straight Medi-Cal. Now, I know probably most of us here have Medicare and hopefully a good supplement or second insurance. So my main concerns really fall with the people that have Medi-Cal, and I see all the problems that we're facing, which is amazing to me in our county that, although I don't have numbers, we have a substantial amount of people that rely on the Medi-Cal system. I work in a physician's office, and we have Medi-Cal patients that we would like to refer out of our county because Sonora Regional is not equipped to handle some of the more major cases. And one that comes to mind was a small boy who needed to have some surgery. We referred him to UCSF. They do not contract with his insurance. We tried Stanford. They do not contract with insurance. So where does this person go? You call the insurance company and you ask them to authorize the referral. They will, but the problem is the facility does not have a contract. So they say we have to have a letter of agreement. Well, it just gets dropped. There is no letter of agreement, or else they would be contracting with them. And this seems to be growing. And lately, I have found more and more physicians within our county that are not contracting this year with California Health and Wellness or Blue Cross Medi-Cal. And personally, we have a son who does have a Blue Cross Medi-Cal. He was treated last year by a physician who recommended a particular surgery for his back. it took 3 months of calling facilities, trying to find a radiologist to do the injections, and he could not, even out of our county. We even called San Joaquin General. They will not take it. So he tried to return to this physician who, as of this year, has decided not to contract. So I just don't understand, number one, why the state of California decided they needed to have outside facilities manage the Medi-Cal program. But it's just practically impossible to find. And we have another son who has Medicare and Medi-Cal, and he was recently in Sonora Regional and transferred to Avalon Care. I thought they would help find a physician to take care of him and follow him after the discharge, but no, that was our responsibility. And I called several doctors. They will not even take the Medi-Cal as a secondary. And fortunately, our family physician bent his rules and accepted him as a patient. So I don't know if any of you have family members that might have this type of insurance or facing these kind of things, but to me, I wish I could go to Sacramento and sit down and talk to them, say what is going on, because I don't know the reason why the physicians are not accepting them, and maybe Bob does. It's easy to say, well, the reimbursements are too low. Well, it was my understanding that these companies that were managing some of the Medi-Cal patients had to follow the same rules as our state Medi-Cal. But apparently that doesn't apply when it comes to the fee schedule. Or it could be, which I've heard from a lot of offices, they don't even try to bill Medi-Cal because it's so hard to get paid. So they just write off the balance. So I don't know the answer, but I'd love to make a survey if I had the time of interviewing these different offices and find out what is the common ground that's causing this problem. And, try to find the avenue that can make a difference in seeing what could be done. But our people are really suffering. So that's great that they got through either what our California healthcare system, they're able to get insurance, but if there's nobody that's going to see them, what good did it do? They end up in the emergency room again. So that's what I have to say. Yeah.
I just wanted to mention that just today, we sent money to a grandson, because the same thing holds true with pharmaceuticals. He's on Medi-Cal. He works all the time. He lives in South Lake Tahoe, and they would not cover his much-needed medication as Medi-Cal. And
Yeah, what are you going to
so
do?
the grandparents do it, right?
Yeah.
Nancy, I do all the learning disability evals for Tuolumne County Welfare to Work Social Services people on cash aid. I used to do them also for Calaveras County. Turn it over to somebody else. But those folks are on those lower levels. And that is nearly every person on that program has those same stories of how.
Can I get the care?
I used to have, it's gone.
That's right. And Sonora, I think we really suffered when we lost the county hospital. And now we have a specialty clinic where the specialist will not take turns, but have a turn at the clinic, such as a urologist, cardiologist. They have a schedule. The urologist I work for, he goes once a month. He has a day there. He sees patients in the clinic. That's great. Who follows up on it? Fortunately, I guess because I'm such an advocate of helping these people, I've signed us up for everything and we take it all. But we're very rare in doing that. And or they to see a doctor, they order an x-ray or IVP or something like that. The next time they see the doctor is a month later. Well, by that time, it's old and somebody wants to order another one, try to get an authorization. Well, you just had one, so why do you need another? I mean, it's a mess. It is, yeah.
You said something I want you to embellish on a little bit. You said that Medi-Cal is now contracted out to private insurance companies. Can you explain that? Where our tax dollars are really going?
I wish I could. I don't really know that. All I know is, like with our labor union insurances, which used to be fantastic, man, if you had, insurance through your union, it was just top of the line. I am going to guess Blue Cross came to them and said, you know what, you spend $100,000 on your medical claims. We could manage that plan for $80,000 and save you that $20,000. The piece that's missing is, once Blue Cross gets a hold of it, they can cut the benefits and change it. The premiums increase. It's not any, I don't know, did it really save the Teamsters any money or not? That part I don't really know. And the same thing happened to the state of California. We had a Medi-Cal program that was just state Medi-Cal. They decided, I guess, Blue Cross and this California Health and Wellness could manage the plan and save the state money. And maybe it does, I don't know. But what I do know is the benefits are greatly reduced and getting the care is greatly reduced, as opposed to when the patients had the straight California Medi-Cal. So I don't know where the dollars go. We talk about that all the time. It's like we keep want to investigate how much really goes into Blue Cross's nonprofit pockets. And okay, great. So that's kind of mine.
Where does Obamacare come into the picture?
Actually, Obamacare does not come into this picture for us, for the Medi-Cal.
No?
No. Covered California, I believe, is more connected with an Obamacare type plan than the Medi-Cal situation.
But didn't they expand Medi-Cal?
They what?
Expanded the coverage limit?
To my understanding, I was going to say no, it's the same people, but they put them in different categories. There's more different types of categories, whether you have a family, whether you're single, what age you are. And I do know that there, I think, are some changes in people, let's see, in helping to pay for some premiums in some way. But I honestly don't know, wouldn't want to say that part of it because I'm not that well educated on that.
I'll cover that in a minute, too.
Good.
I'd like Bob to go now and maybe tell us a little bit about pharmaceuticals as well as everything else we want to talk about.
I have a handout I'm going to pass around here. This is what I use in class at UC Davis for
There's not
basically...
any tests, are there?
You can have a test. This is for
Pop quiz.
Healthcare 101. I'll have to borrow that back
Oh,
again
sure.
here. I'm sorry.
Yeah.
So let me start out with something that sounds really radical, but I want you to take this home, and then I'm going to go through this list. Suppose you're a hedge fund manager on Wall Street, and you have a choice between selling $200 toilet seats to the Pentagon or taking a chunk of the $3 trillion healthcare budget, which is what we spend. And in fact, the way you take that is you just take the money and promise to deliver care, but don't deliver the care, which Nancy is talking about. And you are all being ripped off by Wall Street in some way or another. And you have to get up and complain and write letters and vote for Democrats. So I'm going to start here on the top of this, and actually, in a way, I'm going to start backwards because I want you to understand something that's part of the discussion. It's usually the end. Everybody forgets it because we never get to the end. Number one, we're going to start with balanced billing. Don't worry, we're going to get to Medi-Cal. Balanced billing for charges from physicians, hospitals, labs. What is balanced billing? What is balanced? You got to know, because you might get stuck, especially if you go out of state and
Equal charges across the board for
so
services?
if you're on if you're on Medicare, so I assume a few people in here are over 65. You're lucky, you can't be balance billed. So what it is suppose you go get a chest x-ray in a hospital in the Central Valley, and there is one that charges $600. Your insurance company pays $35. Then the balance is $565. If you're on Medicare, Medicare's law, and it says nobody can be balance billed. We're going to pay you $35 and you can't go after donate. That's really, that should be the law of the land. It's not. If you have, say, Blue Shield XYZ, and Blue Shield has a contract with that hospital, they might pay $50. And because of their contract, you're not balance billed. So you, and the hospital says, we eat it. They don't eat it, they're still making money. But you don't go to a collection agency. If you happen to go to a hospital that does not take Blue Shield or Blue Cross or something, and you get that chest x-ray for $600, and your insurance company says, oh, it's only worth $50, the hospital can balance bill you and will go after you. And this is especially true if people travel out of state, not for Medicare, so people who on Medicare don't have to worry. There was a case in Arizona. Somebody was traveling from the East Coast, went to a hospital because of a rattlesnake bite, had a $80,000 bill. The insurance company, I don't know whether it's Blue something or whatever, says to the hospital in Arizona, it's only worth $30,000. Paid the hospital $30,000. Hospital's still making a bundle. They're making a huge amount. You know, probably making $20,000 in profit on this. The hospital says, hey, the bill is for $80, we got paid $30, we're going to go after this guy for the $50,000. And they went after this guy for $50,000 who got to pay for the rest of his life. Fortunately, he called all the TV stations in Arizona, and it gave this hospital a bad name, so they didn't balance.
Forgave him.
So just to let you be aware of that, if you have children or grandchildren who might get stuck in that, who say, wait a minute, my insurance paid, why am I getting another bill? You know, if the insurance company does not have a contract with that hospital. Now, the good thing is Medi-Cal, which is for less fortunate people, you can't be balance billed for that item, which is good. You can't be screwed over. Let's go to primary care docs, which is number 2 before we get to actual Medi-Cal, which you talked about. So there is a shortage of primary care physicians. Let me tell you, I did it for 3 years at Miwok Indian Health, and we had about 30% Medi-Cal, which it reflects the overall California percentage of people on Medi-Cal. The hardest job of my life. I mean, I'm an ER doc, you know, my DNA's been doing emergency medicine at UC Davis Trauma Center for many, many years. And you know, someone comes in, you can get a CT scan result back within 15, 20 minutes, MRI, all the lab in the world, bam, 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 bam. You just order everything, get all the results, make the diagnosis, and it's much easier in that respect. Primary care doc, as you know, you have a few minutes, they're fighting with a computer to put in all this, information. Did you have poison ivy when you were 14 and walking through the woods? I mean, all kinds of stuff that doesn't matter. It's a difficult job. You can't get your lab back until later. By the time you get the x-ray back, things have changed. It's very frustrating. In the old days, think about the efficient model of medicine is in the doc's office. Anybody who remember that you could get an x-ray and lab, and you get your drugs.
Yeah.
That was really efficient. Wall Street didn't like that, though. So we have this, anybody see a physician who does not use a computer in the room? I mean, it's like, and I hate computers. they take too much time. I could usually, before the computer, walk down the hall and dictate from one room to the other, and it would take 30 seconds, what now takes 5 minutes of fighting the computer. You know, you just want to take a hammer and break it. I think most docs would agree with me.
Yes.
So you can see already, you know, going into primary care, we have to do this is hard. And then, you know, there's this cult in medical schools, which the deans will deny. If you want to be a real person, you're going to be a heart surgeon, you know. The hardest job is being a primary care doctor. That cult has not changed in 20, 30 years. Congress has tried to change it, but there were too many loopholes. People who would go into internal medicine as, quote, a primary care, and then become a heart specialist. Write and complain. We don't have enough primary care physicians here. It's something that the supervisors, Chuck, when you get elected, you need to take this to the supervisor, and they need to write a letter and complain. Otherwise, it will not get solved. Now, the other thing with primary care, just to know, as you know, is not all insurance companies contract with every primary care doctor in a community. There might be 30 doctors, primary care doctors, and only 3 of those have signed up with you know, America Incorporated insurance, with Hancock. And you have Hancock insurance, you can't choose from the other 30 or so. Which actually brings us back to Medicare. If you have Medicare, 95% of docs take Medicare. So you could say that community had 30 primary care doctors, probably 28 would take Medicare. If we go to a Medicare voucher system in which you get the money and can independently choose your insurance company and give them your voucher, which is like Medicare C, which we already have, it's possible that the insurance you buy using your Medicare voucher, this is what the Republicans want to do, will only contract with 3 out of those 30 physicians in the community. What kind of choice is that? It's dangerous. You limit your choice down. Let me move on to Medi-Cal, which Nancy described the frustrations eloquently. It's a second-class insurance. I would say even third. And why did it happen? In California, with the Affordable Care Act and assigning more people on to Medi-Cal, the state panicked and says, oh my gosh, it's going to be the biggest headache in the world. And they contracted out with Centene, which is a Wall Street corporation called California Health and Wellness, as well as Blue Shield, which is a for-profit healthcare company. Blue Cross. Blue Shield is not. Blue Cross, the bad guys. And the deal was that they would reduce the estimated, not the real, cost by 2 or 3%. The California government would say, hey, wow, we're going to save them. And they would deliver the same standard of care. In reality, they took all that money and said, hey, we're not going to deliver the same standard of care.
Right.
We're going to deny care. We're going to give low reimbursements to the doc. Some of these are $40, you get paid $40 for a visit, which, if it's a simple take out one stitch, you can do it. But if it's a complicated person who has diabetes, hypertension, high lipids, it takes longer. These companies basically are there to make a profit. They're not there to take care of you. And this, we need to actually have a petition or a voter referendum to get corporations out of medicine. You referred to denials for x-rays, specialists, the same thing I experienced. She's telling you exactly what it is. You try to get somebody to a neurosurgeon, there is no neurosurgeon. Centene doesn't have a contract with Stanford or UCSF. I forget which one they don't have a contract with. You can't get somebody in to a major medical center because there's no way that they can get paid, even the little that they would get paid. I've had patients who desperately needed CT scans. For example, one case was a CT of the spine. I spent a half an hour on hold because of the first two things were denials. So usually it's the referral person who tries to put in the referral, it's denied, then finally the doc has to get on the line. Half an hour, I'm waiting, with these elevator music. And then I get this person on the line who, I don't know where this person was, allegedly a physician. And I tried to explain to the doc, look, this person, blah, blah, blah. Well, we can't. I said, I think there's an abscess here, and I'm just going to send the person to the ER, and you're going to be billed even more. And if the patient dies between now and then, what is your name, by the way? And that was approved. We get the drug panel, the list of drugs. Okay, if I can, it could fill 100 pages, the drugs that I should be able to prescribe and choose from. It's a little book. It is hundreds of pages. The list for Centene, which is Medi-Cal, the formulary we call it, the list of drugs, it's on one page. It's double-sided. I'm not kidding you. Have you seen that? It's on one page, double-sided formulary.
Yes, and actually today I had to go pick up prescriptions for my son, and it was $200 because it wasn't covered.
So,
And those were the generics. Yeah.
Generic, we'll get to that in a minute. So, Centene and Blue Cross, just really limited what medications can be used that they will cover. Very limited. And, if the person is, if you have, say, for diabetes, for adult type 2 diabetes, there are two drugs and the patient is allergic to both drugs, and then you try to get a exception and can you pay for a non-formulary drug? You can be on the phone for hours, right?
Oh, yes.
So then let's get to drugs. As you may remember, there is a drug for hepatitis C that costs $1,000 a pill, $84,000 for treatment, and you can buy this drug in Asia for $10. The development of this drug was from NIH dollars, your taxpayer dollars. There's another drug for toxoplasmosis, which is a parasitic infection called Daraprim. I used it in Africa. It cost pennies then. The company now sells it for $13. It was the companies that made this were bought by hedge funds, and this guy wanted to raise the price to $750 a pill. I mean, that got Hillary Clinton upset. Hedge fund managers look at healthcare as ripe for picking, and Congress needs to do something about it. As President Obama says, you need to get more involved, and do something about it. Maybe excuse me, because all of you who care are here tonight. These generics that used to cost pennies are being bought up by hedge funds and being sold for a lot more. Doxycycline used to be pennies. Doxycycline is $4 a pill now. Very common antibiotic. As I say, this is something, write your congressman to do something about.
I have a question.
Yes.
I hope it's not boring to anybody else, but my first few experiences with the hospital here was I was not used to hospitalists. Fortunately, nobody went to the hospital for a long time, and so the last time I remember that, your primary care or your doctor who put you in the hospital came and visited you and followed you. So I was curious to find out if these hospitalists is a decision by the individual hospital, or is it some kind of law?
No, this is what has driven this is in the old days, I'll call it the Marcus Welby days, where your doctor, you knew you so well, would take care of you in the hospital. And let me tell you about the efficiency of that. If I'm your doctor and I've taken care of you for years, and then you come into the hospital with, say, pneumonia, it might only take me 5 minutes to do a history and physical because I know of all these other problems. I know of everything that can I know of the drugs that can interact. I know all this stuff. I can do it in 5 minutes. In fact, many of the orders initially are put over on the telephone from the doc's office. You probably remember that to the nursing station. Now the hospitalist does not know you at all and needs to spend an hour trying to figure out what's going on. Tell me, has that increased efficiency? Most hospitalists, not every hospitalist and not every hospital, are employed by corporations, not the hospital. By Wall Street. Wall Street takes a chunk. I mean, Wall Street takes a chunk of what you're billed by the hospitalist. They take a chunk of the supplies, the Band-Aids that are used, the suturing material, the artificial hips, all those things. Corporate America is there. People don't realize that, except some of the writers in the New York Times.
Hey, Bob,
Yes.
when the mafia was doing it, they were calling it protection.
Yeah. That's right.
Yeah. And it's growing, it's not stopping. So people don't think it's like getting better. So your co-pays are going up because insurance companies are figuring out ways to hide it and requiring you to pay more. The insurance segment keeps 20 to 25% of the healthcare dollar, of that $3 trillion. So, they keep close to $1 trillion. I'm sorry you're so upset, Dominic.
Wait till you hear what I got to say.
And in other countries like Switzerland, other modern countries, administration, by the insurance company is 2 to 5% in overhead. So we got a big problem in this country. And as more people age and need more medical care, this is really, I think, the big political issue of 2016. Yes,
Can I make just a couple of comments?
Oh, absolutely.
You described the nightmare of the U.S. medical system, and you said that the medical system is basically a $3 trillion business approaching beyond 18% of gross domestic product.
yes.
In other words, almost $1 in $5 spent in the entire economy is spent on this. And a Republican congressman I heard on the radio saying, do you want to mess with a $1 trillion insurance business? So what he was saying was that the medical insurance business is $1 trillion, and the medical business is a $3 trillion business. In other words, 1/3 of the cost of medicine in the United States is the insurance, and they are not delivering care. In fact, they're trying to avoid delivering care.
Right.
Now, this outrage, and we are the Democratic Club, and it is time for outrage.
It is.
And we've got Jim Hightower coming here toward the end of the month. And I went to the library and I just saw this book and I picked it up. He's describing this book was written in 2004. But he's describing the Bush family, basically, and that kind of plutocracy that is now, was started from Ronald Reagan on, of course, but was perfected bit by bit over the last 30 years. And he describes this so eloquently, the ripping off of the American public, and why, as Democrats, are we not able to create this sense of outrage that people would vote for Democrats? Okay, Democrats aren't perfect. No one's, the political system is not perfect. But there's sure a hell of a lot of difference between Republicans and Democrats.
Paulo, I am so outraged, I'm running for Congress.
Yeah. And get me up there in the insurance place. I have a lot of
Spell the name of that Wall Street firm, California Wellness?
California Health and Wellness.
No, what's the name of the?
Centene.
How do you spell it?
CEN.
Thank you.
Robert Careless. Oh, I'm sorry. That's what somebody,
Spell it again. I just wanted to make a comment.
oh, Robert Careless first.
Oh,
Briefly, you should understand that it's not simply at the federal level that we can attack this problem. Canada actually created the Canadian healthcare system one province at a time.
That's correct.
And it was so successful in a single province that it spread throughout Canada, and that's how Canada got a single payer system. We've also had it on the governor's desk, a single-payer system for California. We have every opportunity to do it on the statewide level, so while Derlet's working on it in Congress, trying to get it moved, which will of course be difficult because we have the stonewallers in the House. In the state of California, we've actually had it on the governor's desk, and we'll get it signed this time.
Diane Doddridge.
I just wanted to say my only brother lives in Germany, and some of you have heard about his situation with Syrian refugees he's taken in, 7 of them, and is having a great time with his family. But the thing I wanted to mention was that he told us, we've been there a couple of times to visit him, they pay 50% in taxes. He lives very well. And when I say well, I mean health-wise too. I'm amazed. He's had colon cancer. He's had the best care. Things even to the point where after he's had surgery and recovered at home, he goes for 6 weeks or 8 weeks to a spa where he gets massages every day and water treatments and all these things as follow-up care. That's all paid for, all of it.
Yeah.
And he has said to me so many times, it's wonderful. Plus college for his child, plus transportation. It goes on and on and on, so,
It's democracy too.
yeah.
I mean, you know,
Denmark
anyhow,
was the same.
I want to go through, oh, I'm sorry, I want to go through a couple things here
We were there.
that, not only the stories Nancy told you about our 2 sons, but the thing is that I got started this, and what made me call these 2 people here was, I happened to just check through my office personnel management send out for the next year, what my costs are going to be, et cetera. Well, my salary is going to remain, and my pension is going to remain unchanged. No government employee got a single nickel raise in 2016, 0. Now, there's legislation being forced through by some Democrats trying to change it. Remember, no increase in salary at all, yet they were taking out 11.7% more out of my check, my retirement check, to pay for my health care premiums, which really haven't changed. It's Plan 105, which Nancy says, you know, her and I, and that's it. And so I called my, not my union, but I called the organization that represents federal retirees and found out that the Congress only negotiates with the pharmaceuticals and the insurance companies. No other party is involved in those negotiations. All right, now this is significant, and I'll get into something later on, very significant, okay? So there's only 2 people in the room, the Congress and the insurance companies. That's it, all right? So that was step 1. Now, I'm going to digress a little bit here and talk to you about Blue Cross, or Blue Shield of California. Read you one line. I had this before you guys even got started. It says, Blue Shield of California is the state's 3rd largest health insurer with about 3.4 million members and 13.6 billion in annual revenues. They're the 3rd, okay? 13.6 billion. All right. Non-profit insurer Blue Shield of California boosted executive compensation by $24 million in 2012. 64% jump. That was 3 years ago. They've almost tripled that since. All right? And that's one company paying $61 million to a handful of executives. That's not the worst of it. Then you go on to find out about United Healthcare, the largest insurer in America. And United Healthcare CEO Stephen Hemsley took home over $66 million in 2014. Yes, times are good for Mr. Hemsley, who actually earned an even more eye-watering $102 million in 2010. All they're doing is taking our money in, putting it in their pockets, and kissing us off. That's where all our health care is. That's why we're on ration health care. It's because the insurance companies and the pharmaceuticals are stealing us blind. I mean, they're not even smiling about it. They're just running off on their yachts and forgetting all about
And
it.
you know what? And the doctors are getting paid less and less.
That's right, the doctors.
Hardly enough to cover. And then they impose all this buying of these new software and it was like $60,000. And it went up to like $120,000. How do they expect us to pay for that? And you're reimbursed at $24 per office visit? I mean, it's so out of
Oh,
whack.
and it's, all this computer stuff is driven not by the government, but initially by the insurance companies. It's this game of, well, we're not going to pay you unless you electronically transmit
Yes.
what's going on. And it gets more and more complicated. Well, we're not going to pay you if you, unless you found out there was a tattoo on somebody's, underneath their
That's
foot or
right.
something. It's like,
All-
did you look under their foot? I mean, just craziness. Go on, sorry, Dominic.
Yeah, sorry.
No, that's not the point. Yeah.
Well, we all know this, but what can we do about it? You see,
Well, that's what we gotta get to in a little
The next
bit.
step is
We gotta get to
be
that in a
able
little
to
bit.
fight it.
Well, we have-
First of all, something is being done about it in California, but it's not gonna be enough until we get the single payer.
My
But,
son needs an operation, he's gone every single day for 2 weeks to the social services, and they put him off, and they go, he's gonna have to go to emergency, because he's gonna have, his stomach is
Well,
going to...
that's what you're.
Oh, that's exactly,
Too bad about Mark.
I
That's what I
know.
was going to.
The other thing is that
He has
you
cancer.
was, yeah, Diane was saying that in Germany, her son pays
My brother.
half, your brother, pays half as much, half of his income in taxes. The Germans pay half their income in taxes. And that may be true. Americans pay less taxes. That's not true. Americans pay around 30% of their income in taxes.
You gotta take care of the defense.
In fact, poor Americans pay a higher percentage than a lot of rich Americans, percentage-wise. And you've got to add to that the now well over 18% of gross domestic product, which is the cost of medical services. You've got to add that to the 30%. What's that? 48%. And we have lousy roads, almost non-existent public transportation. We can't afford to build a railroad. Every other country in the world, China can afford to do it. There's something very wrong. We have to keep the message simple. We mustn't let our message be in detail. We have to create that sense of outrage, of people outraged. That's why Trump is doing so well.
That's why the NRA is really pissed, because they're not the biggest lobbyists anymore. I want to go through one more thing, and then I want to go cut to the real nut of this whole thing. And that's that I heard rumors that our in Washington Township Hospital in Fremont, which is a real nice hospital and all that. Nancy Farber's the CEO there. She has been, she's an uncle. And I heard that her salary was voted on by the board at the hospital, 7-0, to raise her salary to $1 million a year, plus benefits. $1 million a year.
Washington Township Hospital.
Yeah, Washington Township Hospital, a 200-bed hospital. All right, it's a primo hospital, it's nice and all that, but $1 million a year. Well, there was a big bitch going on about her making $1 million, so it went to the board that covers this for the state, and it appears that they voted on that any nonprofit CEO now will make $1 million a year. That'll be like a base salary. Now, I haven't got that confirmed because that just came out like a couple days ago, all right? But I know for a fact she's getting $1 million now. All right, so the thing is, that's out of control. Now at UC Davis, there like a dozen officers or officials are making $1 million or more at Davis.
No, I think at UC Davis, it's only the hospital director that makes $1 million. But I think it's Sutter, this is old data from a year or so ago, that there were like 30 administrators at the headquarters of Sutter Systems that were making over $1 million.
Now here's what we can do about it, all right? Back in 1991 was the first shot at getting universal health care, single payer, 1991. That's a long time ago. That's when Hillary Clinton tried to bring it in and got snubbed and smashed and all that. Then it comes up, I'm going to speed through time. Thanks for coming.
Thank you. Very good.
Anyhow, let me speed through the arguments I used to have with my good friend Paulo Maffei about how we got screwed out of our Tuolumne General Hospital. Right? And Paulo and I disagree on this, and the disagreement's good, but I'm going to make you feel a little better. I found out that you guys were actually, there was a change. When you first hired the Lewin Group, or started looking into them, they were pro single family, single payer healthcare. They were pro, public healthcare and all that. And they got so powerful at it, they were being cited in Congress. All right, the Congress was quoting Lewin Healthcare Group. I'm going to read some of the quotes from Lewin's final big report, the last one they had before United Healthcare bought them out. And the whole thing changed. They were sitting there all in favor, had justification all over the place for single-payer universal health care. Medicare for all, no parts, nothing. We just do like Germany, pay for it, all right? Now all of a sudden, in 2007, United Healthcare said, wait a second, we're getting our asses kicked here. And we're going to take pay cuts and everything else if they keep going like this because they're going to come in with this thing. Right away, they came out, bought Lewin Group, and Lewin Group changed. Now here's what Lewin Group said about California. I'm going to take one state. There's about 25 states they did studies on, all just like this. A study by the Lewin Group finds a single payer could save California $343.6 billion in healthcare costs over the next 10 years, mainly by cutting administration and using bulk purchases of drugs and medical equipment. That's the first line, all right? That's 2005, all right? The Lewin report, prepared by an independent firm with 18 years of experience healthcare cost analysis, affirms that we can create a fiscally sound, reliable insurance plan that covers all Californians and controls health cost inflation. That's the Lewin, okay? They said save about $8 billion in 10 years on certain healthcare things, $20 billion on administrative costs, et cetera, savings overall, et cetera, et cetera, et cetera. Comprehensive benefits. The Lewin report assumes an insurance plan that covers medical, dental, and vision care. All of it. The whole thing. No questions asked. You go in, you give them your card and all that. That's Lewin Group in 2005. Then all of a sudden, in 2009 comes out the fact that Lewin Group Vice President John Shields says his firm had nothing to do with the Ingenix. Ingenix is a company that controls all the computerized stuff, apparently. They're the ones behind it. They've recently had to change their name to protect the guilty, which they've done, all right? But anyhow, Lewin's clients include the government, et cetera, et cetera. And Lewin's group also included the Commonwealth Fund and the Heritage Foundation. A fund and a political right-wing committee. Now, I'll tell you, that's what happened. They sat there and they were doing good. They would have probably done good at TGH, except they got bought out by United Healthcare. United Healthcare saw the money in getting rid of the public hospitals and going to the private sector hospitals, more money for them and all that. That's why the insurance company, I understand, and I haven't got any documentation on this because this is all hush-hush stuff, but Lewin Group was being paid and other lobbyists during the Obamacare battle when we had the public option on the table. $104 million to Congress every single day was what the lobbying fees were. $104 million every single day. They were going to pay billions to make sure that you did not get single-payer, universal health care, Medicare. These guys are crooks. They ought to all be thrown. Did anybody see The Big Short? Yeah. Makes these guys, makes them look like, choir boys. I mean, these guys are just scrounged money. 33 cents out of every dollar. It's actually 37 cents out of every insurance dollar goes to the insurance companies. Goes to the insurance companies. It's more than what even ITAR says. If you want to be pissed off, I'm going to send this out to everybody. I'm going to send these 2 reports out. You can read them at your leisure. You can throw them away, whatever you want. But it's so profound how the transition just came. It's like, it's unbelievable. One day they were sitting there justifying why we have to do it right now and how good it would cover everybody and it would cover everything. The next day they're bought out by a major insurance company and the whole thing changes. And we just got sucked in and do. So that's my presentation.
I just have one comment. Tonight I heard, and most of you probably did too, that Bernie Sanders, who promotes single payer, is leading Hillary in Iowa and New Hampshire.
Yeah. As long as it's got a D on the end of it, that's all I do. But,
But what I heard, oh, never mind.
This helps.
Bernie, I almost sent this out. Bernie had a great, he was interviewed by, I can't think of her name. She's really a big wheel with ABC, like their chief female interviewer. Ann Conley, or whatever her name is. And she started asking about, well, what do you think about, the first question was, what do you think about Trump calling out Bill Clinton for his transgressions. He says, he's since changed this thing, but he says, well, I think what people are more interested in is how they're gonna get the kids' tuition paid for school. Then there's people that are already going to school, you know, he just blew her off. And that's what I love about Bernie Sanders.
Yeah.
You know, he goes right for it. You know, that's it. So anyhow.
And he's a single-payer man.
And I want to let these two people, I want to let one of them go because I know she's been going since about 6 this morning. So I'd like to thank our two guests for being here tonight.
Oh,